Dr. McGarry, I think the patient in 68, it's a female, 65-year-old female with pneumonia on the right side in the right lower lobe. I think she could benefit from an osteopathic manipulative technique. These techniques would be sort of aimed at her thoracic inlet, her abdominal diaphragm, and her rib motion. The goal would be to increase lymphatic drainage throughout the whole system. First, we could start out with loosening up the first two ribs and the interscalene muscles to aid with the thoracic inlet. We would then move down to the abdominal diaphragm and try to reduce any of the restrictions in that area. You can tell that she has an inhalation defect on the right side, and I would sort of aim some of the rib techniques there. We could also do some rib raising. I think all of these things would benefit the patient. Her only past medical history is hypertension. I've read papers that have shown, and I have that here for you now. This paper sort of talks about the use of OMT in pneumonia. It's been dated back since the Spanish flu. They've shown that patients have a lower time of stay in the hospital, reduced costs both on the hospital, obviously on the patient. The patient outcomes are better. And I think this patient could really benefit from it. I think, like I said, the benefit would be reducing congestion, aiding in the lymphatic drainage. A risk you would have is if she had a major infection. If you look at her vitals and you look at her white count, she doesn't have a serious infection. She doesn't have active metastatic cancer right now or anything that would be a contraindication to her getting these techniques. They're relatively low risk, high benefit. Again, the benefit would be reducing the disease burden on her financially as well. So I think this would be a good strategy. There's also video on this website at the bottom of this that demonstrates the authors of this paper have also made a video showing these techniques. So I know with your MD background, you might feel a little less willing to go out on this limb and work with osteopathic medicine. But if you watch this video and read this paper, I think you might be convinced that the benefits, again, we talked about risk benefits, we talked about the contraindications, and we talked about why and how she's sort of the right demographic, how she would benefit from this. What are your thoughts on that?
Well, Dr. Adler, I think that you have a very good, solid understanding of what you're trying to explain to me. And honestly, I think that you have a very good viewpoint on everything that we should try to affect on this patient. So I'm going to follow your lead, and I'll probably follow these directions right now. We'll check this out for you.
All right. Well, I hope our patient does better. Thank you.
You too. Thank you.